I would say the key issues going in are, how do we do this? How do we actually take all the pieces that have been building in recent years, where we've gotten smarter and more knowledgeable about assessing and improving quality of care, focusing on making care safer, trying to make care more patient-centered and so forth. How do we bring this all together in a scalable way? And I'd have to say I think those are the issues coming out as well. It's almost as if our ideas are ahead of our operational models, and my great hope is that we can begin to close that gap. Some of our biggest challenges are going to take more than the next year or two. I do see in the very near-term future, and you can read this all over the Affordable Care Act, that there will continue to be a strong focus on preventing readmissions to the hospital that presumably many of them of which are preventable, and that there will be a very strong focus on continuing to try to get to eliminating healthcare associated infections. This is something everyone understands. You don't need to have an advanced degree or understand statistics to know there's something wrong with this picture if you go into the hospital with one problem or any healthcare setting and come home with a second and possibly worse problem. We can do better than that. High value sounds great. It is great. I think that we need to deconstruct it and link it to what people can see and experience. It's a little bit like talking about patient-reported outcomes. I know that's incredibly important. If I say to a family member, what this means is that the doctor and nurses taking care of you are judging whether something works by how you feel, in your words. Oh, they get it then. So I think in terms of value, we're going to need to say this in ways that people can understand. What does it mean if we make care more efficient? Does it mean less waiting time for you? Does it mean that you can be really confident that your information moves to the next link in the chain and so forth? That's what I think we need to do. I think events like this bring people together who share a common passion for improving health care and trying to understand how healthcare policy can support those efforts. And you know, by definition, healthcare is extremely local phenomenon. So improving quality for the nation will ultimately represent the sum component or total of many, many individual pieces, one interaction at a time, one admission to the hospital at a time, and so forth. So if you're really passionate about improving care, your focus is real local. A conference like this actually helps you expand your horizons and hear how other people are potentially applying different solutions or thinking about the same problems. And that's always energizing and I think a good thing for the American public.